And we're not going to go in the detail of the treatment because that in itself is a lecture, but important thing here, number one, levodopa is the normal treatment for the Parkinson's disease. Levodopa is a dopa agonist. Why do we not give dopamine itself? Dopamine is not given because it does not cross the blood-brain barrier. That is a step question there. We give levodopa, it needs to be converted to dopamine and then it becomes active. So it can be converted to dopamine, but it gets converted to both dopamine in the brain and in the periphery. Now what happens is, if it becomes converted to dopamine in the periphery, there are two problems. Number one, there is not enough dose that goes to the brain because the converted dopamine does not go to the brain. And number two, the peripheral dopamine conversion causes the effects, for example, nausea and other, which are not desirable. So what do we want to do? We want to create a drug, or we want to give a drug that will go in, become active both in the brain and in the periphery, but then we do not want it to be converted in the periphery. So how do we do that? We give carbidopa. Carbidopa inhibits the enzyme that converts the levodopa into dopamine, but carbidopa does not go to brain. So carbidopa would not let the levodopa become dopamine in the periphery. That allows a greater dose or the right dose to go to brain. Number two, that removes the peripheral side effects of dopamine. This is very important, and again this is a steps question. Now dopamine is present, levodopa goes to the brain, it crosses the blood-brain barrier, goes into the brain, it becomes converted to dopamine, and then it affects. Now the problem here, tell me, when the dopamine goes to the brain and it has its effect on the D2 receptors, wouldn't it have its effect everywhere? Yes, it will. So not only it would treat the Parkinsonism, that is, it would help the caudate and putamen nuclei to be excited, and they would be, the acetylcholine receptors would be working. However, the mesolimbic, mesocortical and hypothalamo-pituitary cells would also become affected. What would happen? For example, mesolimbic D2 receptor, schizophrenia. Similarly, what would happen to the pituitary, hypothalamo-pituitary axis? That would cause the suppression of the prolactin, and that can cause galactorrhea. So you have to know these things. Now, in reverse, if we talk about the Parkinsonism, we just talked about idiopathic and some part of hereditary and how that works. How about the acquired Parkinsonism? Acquired is very simple as well. What happens is, many times the mesocortical pathway is suppressed through antipsychotic drugs, for example, for schizophrenia. The function of the antipsychotic drugs is what? They are going to suppress the dopamine. When the dopamine is suppressed, look at this pathway. What's going to happen? Dopamine is suppressed here too. When there is dopamine suppression, isn't that equal to not having dopamine or not having dopamine neurons? Isn't that equal to having Parkinsonism? Yes, so that is acquired Parkinsonism. So when you have a patient who you put on antipsychotics, and within 4 days to 4 months he comes back and he says, I've developed tremors or rigidity, or I cannot express myself, or I have a urinary problem, or I have hallucinations, or I've been sleepwalking, all these are signs that there is a possibility of Parkinsonism, acquired Parkinsonism starting. So what do you do in that case? Do you discontinue the drugs? No, you don't, because you want to treat the Parkinson, psychiatric problem. Do you give dopamine so that you have the dopamine available? No, because you gave anti-dopamine or dopamine antagonist for a reason, and that was to reduce the psychiatric problem or reduce the mesocortical pathway. If you give dopamine, you would reverse that effect. And not only you would reverse that effect, but actually you would enhance it, because the dopamine would go and act on the mesocortical pathway, mesolimbic pathway, and exacerbate the psychiatric problem. So what do? Here is a good news. Here is a good news, and this is again a step question. The good news is this, that acetylcholine, what is happening with the dopamine? The acetylcholine neurons are now working less. So what you do is, you provide the anticholinergic drugs, you provide the anticholinergic drugs to suppress. So I misspoke here. Acetylcholine pathways have become extra functional because D2 pathway is suppressed. So to reduce the effect of acetylcholine, you simply give anticholinergics. So that would take away the tremor that comes with the antipsychotic drugs. So that is also a USMLE step question. Cool. So these are the basic ideas about the Parkinson's. Thank you.
Like this video and smash that subscribe button as well, and make sure that you hit the bell button and get the notifications for the new videos in the future.